Biosecurity is a word that often sounds scary. In fact, it should remain a simple tool.
It is a set of measures designed to prevent the introduction of diseases in a herd or prevent the spread of an existing infection in the herd.
From the outset, it is important to segregate heifers from adult animals. Why? Because adult animals carry a lot of pathogens, even if they are asymptomatic, that is, they show no symptoms, but they host microbes and they can spread pathogens in the absence of a significant level of segregation between heifers and adult animals.
Heifers are young animals whose immune system has not yet fully developed. Of course, on any farm, there are heifers that have a high genetic potential, while others will be more average, but they must all be treated the same. Don't forget that if you take an average heifer that has not received any colostrum, if it gets sick, it becomes a source of infection to other animals. Ideally, unweaned heifers should be kept in some enclosure that is separate from the rest of the herd. They should be housed in an area that is clean, dry, and draft-free. When an animal gets sick, it's important to keep it isolated from the others to prevent the propagation of the disease as much as possible. Best practice would be to have screening tests performed prior to the arrival of the animal at the farm. Tests give you an opportunity to see if there are any developments, any diseases. You must isolate the new subject for at least 3 weeks, and then keep an eye on the rest of the herd because the new animal comes with its own population of microbes.
A protocol has been suggested, a brochure has been put together. The brochure explains various issues pertaining to certain diseases and, generally speaking, provides a set of preventive measures, including a purchase contract between the seller and the buyer. Another issue about the closed herd aspect: visitors. You should control the access given to visitors. Control means deciding when there are visits, if there will be special clothing requirements, what the disinfection procedure will be. Visitors can introduce pathogens into a herd. Dehorning is a procedure that is obviously necessary, preferably before the calf reaches 2 or 3 years of age. It's not always convenient within the context of a day-to-day farm management, so the timing may be extended, but generally speaking, acting before the animals are 2 months old is better. Different techniques can be used to dehorn calves. First, you have dehorning paste, dehorning pencils, pencils that contain a caustic product. Those can be used on calves up to 2 weeks of age. After that, they are much less effective because of the regrowth, which is of course not desirable. Another technique uses a hot iron to burn off the horn buds. That can be easily performed within the time frame mentioned earlier of 2 months or less, be it 2, 3, or 4 weeks of age. It is important to point out that the older the calf, the more the horns will develop and the level of pain and discomfort experienced by the animal after the procedure will increase. Once the animals are older, the technique of choice becomes surgery, and of course, that brings its own set of problems: pain, bleeding, and an increased risk of transmission of leukosis from one animal to another. It is possible to use products that will improve the animal's comfort when the procedure is performed. The farmer should consult a veterinarian. At what age should extra teats be removed? Usually, they appear at about 6 weeks and they can be easily identified. That is when you should think about taking care of it. How is that done? With a sharp instrument or scissors. And it is important to remember that if you use the same instrument on several animals, you must implement a disinfection procedure in order to avoid propagating diseases such as leukosis. The longer you wait, the more the procedure will be risky, painful, and also risky for the handler. That's an important factor to consider. The benefit of gathering information, collecting information, health data about heifers is immediate, in the sense that it helps to organize the work and to act early on.
Everything that has to do with colostrum, the quantity of colostrum given at birth, how long after the birth, the quality of that colostrum, we do have those data. Also, who gave the colostrum to the animal. Appetite information should include refusals, the quantities consumed in relation to the quantities that are offered. You should also record the attitude displayed when the milk is offered. If the calf is playful or depressed, lying on the ground, if the calf takes a long time to drink its milk, it might mean that the animal is not healthy. Other items to check for would include diarrhea, record the day of onset, what treatments have been given, and in terms of respiratory health, does the calf cough? Is it breathing fast? Are there any discharges? If so, record the first day on which these events appear and what treatments have been implemented.
If the information is collected on the computer, it will go much faster to analyze what is going on with the herd. We have cues right away, and the veterinarian will be able to make a more informed analysis that will be more revealing, that creates a quick return for the producer, a very economic return. What I would like producers to keep in mind is the fact that preventive medicine goes beyond the obvious things we can think of. Drugs, vaccines, dewormers. It extends beyond these things because the real issue is controlling risk factors. The veterinarian who visits the family will be in a position to zero in on the strong points and the weaknesses of your herd management structure. And that's at the heart of preventive medicine. Proper control of those factors will lead to optimum health among the herd.
Of course, with the DSC veterinary package, with the software you have everything. It's easy, you know everything. On such and such a date, you have to do this or that, and with feeding programs including milk replacers, you prepare a schedule at birth, and then you follow the chart. It's a management tool, a matter of discipline and patience. Everything is recorded: vaccines, services, didn't feel well, caution diarrhea, temperature up to 39.5, check again tomorrow. Every single event is recorded. Every time visitors show up, if they want to see the cows, they might need to have access to plastic boots, because not everybody wears boots that can be washed. I realize that it's dangerous to let anybody in like that. If I see a livestock dealer looking for animals all over the place, who goes from one barn to the next, and he wants to see my animals, I might be a little more reluctant. It's asleep, it's numbed up locally, then I'll burn its horns. And before it wakes up, I will also check for extra teats and take care of that at the same time. Then, before it wakes up, I'll give it some pain medication to make sure that it won't suffer too much when it wakes up, because sometimes, if they hurt too much, they won't have much appetite in the evening. And for the pain, of course, I have to give them something. Because it's a bit like young children who are teething. Except the calves were just dehorned, so you have to give them something.